Hey, I'm Luke Schellenberger. I'm an ENT doc. So I was talking to a patient the other day, and he had said, I was having some trouble breathing, and my dentist said I should get some nose cones. I was like, nose cones? What are you talking about? It was like these things I stick in my nose, and I can breathe better through my nose. I was like, all right, so I've heard of breathe right strips, and I'd seen occasionally some things about nasal dilators, but anyway, so I got on Google and Amazon and wrote in nose cones, and up comes a whole bunch of different types of dilators. So this one says, this is called DORTS, called the Snore Care Set. So pop these things out. We've got a bunch of them. And it looks like we have 8 different nose cones of a variety of sizes. Kind of get them. Got the small ones, medium size, and big ones. We'll try some small nose cones here. Yeah, breathe a little bit better. Kind of feels a little bit funny. Let's try these. I'll try out these big ones. Oh, man. Man, I feel like I got some snorkels stuck in my nose. Yeah, they definitely feel more open. So when I looked up nasal dilators on the internet and looked up snoring, because as a ENT and as a sleep medicine doctor, so I'm going to take these things out a little bit too open. I treat snoring all the time, and I treat nasal obstruction all the time. I wanted to see if there's any research on nasal dilators and snoring. Sure enough, there is. In fact, there is a review of all the different articles that have been written over the years. It was published in 2016 by Pulmonary Medicine. And it said of all those 14 articles, so there's been 14 studies done on nasal dilators of a variety of sorts and snoring, and actually none of them show that they work. And that makes sense, because really our snoring is not generated from nasal blockage. Sure, your snoring may get worse if your nose is completely blocked up, but most of our snoring is due to vibration from the palate, which is the roof of the mouth and the back of that floppy tissue back there, and the sides of the throat and the back of the tongue. And so, your nose can be open, your nose can be closed, but if you've got a lot of obstructive tissue at the back of your throat, that's where the snoring's going to come from. So I'm not really sure why they put snoring on nasal dilators. I would imagine they would be more marketed towards you can't breathe through your nose. These will help you breathe through your nose, because research does show that that does work. And so anyway, I think these things they may serve a purpose. I'm not sure if you need, all 8 of them, or if you need, but I guess kind of having different sizes, you can try different ones and kind of find the one that makes the most sense. I really think that this would be a lot more beneficial than getting stuck on Afrin or nasal decongestant sprays. I've written blog posts about how much I dislike Afrin, and there's a lot of patients that they can't get off Afrin, and so using these at night to allow you to breathe better through your nose, be able to get off the Afrin, that's where I would really see the benefit. So anyway, nose cones, oh so attractive, but effective for breathing, but not for snoring.